Have you ever heard that family caregiving in Asia is an obligatory? Is it really the case? Hi everyone, my name is Sinta Kristanti. I am an assistant professor from Department of Nursing, Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada, Indonesia. My presentation is focusing on the journey of family caregivers of persons with dementia in Asia. Obligatory vs. Voluntary Act. Family defined as a group consisting of one or two parents, their children, and close relatives. In Western countries, they tend to be nuclear type of family. In Asian countries, we tend to have extended family. A big group of family members are closely involved in our daily life, including during caring for the sick member of the family.
Let me bring you closer to a real case of family caregiver of person with dementia in Indonesia. Yulia, 35 years old. She's a mother of 3 teenagers. She's a lecturer in one university. Due to her husband's commitment of work, he needs to live and stay in another city and only come back twice a month. Yulia is living at her mother-in-law's big house to look after her who diagnosed dementia. Yulia, as a good Muslim, was taught that looking after parents will receive big pahala or reward from God.
But dementia hasn't been that popular in Indonesia at that time. Most friends and relatives think that forgetting something is a sign of normal aging, nothing to be worried about. They have no idea that person with dementia needs consistent supervision. Person with dementia is wandering and can be lost. It can also be dangerous to let them stay at home alone. They can turn the stove on and forget to turn it off. The challenges are real, especially when you are a daughter-in-law and you didn't even know your mother-in-law very well when she was healthy. When we ask her a question, do you have to do this as a daughter-in-law, or do you choose to be a caregiver? Well, she needs some time to respond on this specific question. This question is actually also stays in my mind for quite a while. Is family caregiving in Asia obligatory or voluntary? The answer can be tricky because which Asia are we refer to? Which country in Asia? Based on the United Nations, Asia is divided into 5 regions. Culture are wide varies among these regions. Economically, Asia can also be divided into high, upper middle, lower middle, and low income countries. In caregiving, not only that economic situation, but also the culture affecting the family caregivers' experiences. When caregiving context and setting are varied between Asian and Western regions, we are wondering if the impact on family caregivers are different between these 2 regions. We conducted a systematic review to get an answer of this challenging question. We found that in Western countries, in terms of burden, distress, and quality of life, they are recorded in many studies. In Asia, only low and moderate level of burden were reported. However, in Asian studies, distress was reported to be high. In terms of quality of life, it is reported that in Asia, we have low and moderate level of quality of life. Now, when the figures are clear, but the interpretation remains to be challenging because we did this comparison with the same instruments, but these instruments do not touch upon informal norms and cultural differences. Informal norm is a norm that most people apply. It is not written in a law. In Asia, informal norms in caregiving are things like taking care of elders is expected, then you are not supposed to complain in caregiving. If you do so, this reflects as a failure. If you report distress, then it is a sign that you want to get help, you want to do something, and you are still willing to care. If you report burden, on the other hand, it sounds like you don't want to do it. Considering the norm that you should not complain, burden then may be underreported. In one of our study, we compare the experiences of family caregivers of persons with dementia with those of patients with cancer. We found more similarities than differences, namely problems in caregiving, actions that they took, and consequences in caregiving. Some differences also found in cancer care. Although family caregiver reported to have a closer relationship with the patient along with the disease progress, they reported lots of complaints in the quality of healthcare services. In dementia care, although family caregiver reported to have lost connection with the patient due to cognitive impairment, family caregiver reported to have a strong connection with healthcare professional. In Indonesia, dementia persons are taken care of by either neurologists or gerontologists. Direct contact and simplicity in communication is highly appreciated by family caregivers. Quotes in our study supported the statement that dementia doesn't have a bad stigma in Asia and that community support considers essential. We also studied family caregivers' journey in Indonesia. From our study, we found that belief in caregiving is the core phenomenon. This consists of religion, values, and motives in caregiving. This core phenomenon affects actions and consequences of family caregivers. Belief in caregiving, having a sense of purpose, is an antidote to doubt and challenges. It keeps you going. Belief in caregiving is the willpower of family caregivers in Indonesia. Now, let's come back to our main question on obligatory and voluntary in caregiving. Many studies have described that family caregiving in Asia is an obligatory act. These are the common definitions that we use to describe family caregiving. From this definition, obligation is seen in a more pessimistic way. I believe that this is the time for us to expand our view. We cannot simply define that in Western countries, caregiving is a voluntary act, and in Asia, it's more of an obligation because of at least two reasons. First of all, Asian countries are just like Western ones that have wide geographical areas. There are wide variations in economic level, culture, and facilities that are related to caregiving. Secondly, obligation in caregiving is sometimes framed positively in Asian world. Caregiving is a chance to save their reward in heaven. In Yulia's case, for example, she is glad to get this opportunity. Complying with caregiving tasks is also socially rewarding. They are claimed to be a good member of a family. For this reason, we may need a new terminology to describe obligation and voluntary work in family caregiving. Because if we still keep using the definition of obligation in family caregiving based on a dictionary, then this may lead to a misinterpretation of the real situation in Asian countries. We may miss the beauty of family caregiving in Asia. In Asian countries, another reason why family has a major role in caregiving is because the lack of long-term care facilities for disease like dementia. But the question is that, if the facility is provided, will people access it? Because informal norms are applied from generation to generation, and this may become the strength in family caregiving in Asian countries. Come back to Yulia's case. She doubts that she dares to put her mother-in-law in a nursing home. Her heart cannot take it. Also, she cannot take what others may say or think about her making that decision. So, to be able to support family caregivers in this region, interventions and facilities in Asia should fit with informal norms. Otherwise, nobody will access it. I am Sinta Kristanti. Thank you for your attention and looking forward for our discussion.